How to care for a child with a cough. To care for a child with a cough, you have to gather enough information about the child's signs and symptoms. You will then be able to decide what to do next. To help you with this decision, it is useful to think of the signs and symptoms associated with a cough as indicating a mild, moderate or medium, or severe or extremely serious illness. A cough on its own is usually a sign of a mild illness such as a common cold. If the child is at risk of tuberculosis or TB or has fast breathing, the child may be much sicker. If the child has chest indrawing or is struggling to breathe, then they are likely very sick. Let's explore each of these in more detail so that you can recognize when a cough is a sign of a mild, moderate, or severe illness. Remember that this can change over time and a child may get worse quickly, so it's important to reassess the child over time and educate the family on danger signs to look out for too. A cough can be a sign of a mild illness if the child has no fast breathing, no danger signs, and has not been in contact with a person with TB. It is likely that the child is coughing because of a common cold. Moisture from the nose drips down the throat and into the lungs, causing a cough. This can also irritate the throat, which can make it uncomfortable for the child to eat or drink. Explain to the caregiver how they can treat them at home. All sick children should drink a lot of liquids such as breast milk for a child younger than a year, for a child older than a year, water or tea with honey to soothe the throat and lessen the cough. Paracetamol, if it is available, can help to lower the fever or relieve the discomfort of a cough. There is no need for other medicines, as cough medicines can contain harmful ingredients to children and are expensive. Tell the caregiver that if the child starts struggling to breathe or becomes sicker, they must take them to a health facility immediately. Let's look at when a cough is considered to be a sign of a moderate illness. This occurs when a child may have been exposed to TB or has fast breathing. A child with a cough could be infected with TB if they have been in contact with someone who has TB, lives with someone who is on TB treatment, or they have been coughing for more than 14 days. Ask the caregiver to take the child to a health facility as soon as they can, where they will be tested for TB and get medicine to prevent TB. A cough with fast breathing can be a sign of a lung infection called pneumonia. Lung infections can be caused by bacteria or viruses which are treated differently. If the child has a runny nose and a sore throat with a fever and cough, it is more likely the lung infection is due to a virus. A cough that is caused by a virus can be treated with supportive care, such as extra liquids. If they only have a fever and cough, it may be due to bacterial pneumonia. According to the World Health Organization, or WHO, treating a child who has a cough and fast breathing due to bacterial pneumonia with antibiotics such as amoxicillin can be very helpful. If you cannot prescribe this medicine, refer the child urgently to a health facility for treatment. A child may have signs of severe illness if they have a cough, fast breathing, and have been in contact with someone with TB. Another serious sign is chest indrawing. In these two cases, you must refer the child immediately to a health facility. The World Health Organization recommends that, in these situations, the child receives a dose of antibiotics on their way to the health facility. If you think that the child has bacterial pneumonia and you can prescribe antibiotics, then this should be considered. Lastly, if the child shows signs of struggling to breathe, this is very severe. If you notice any signs like tugging at the neck and widening nostrils when they breathe in, a grunting sound when they breathe out, being unable to wake up, turning blue, you need to act now. The child must get to a health facility for treatment urgently because they are in danger of dying. There is a lot to remember, so we have made a job aid that summarizes the signs and symptoms and what to do next. Always remember to follow these key steps. Start by assessing the child to find out their signs and symptoms. Based on their signs and symptoms, decide how severe the child's illness is. Then, either treat the child at home or refer the child to a health facility. Remember, if the child has any danger sign, they should be referred to a health facility urgently. It doesn't matter what the cause is of the symptom. Look at the other videos that explain how to refer a child or advise the family on home care.